Staying truly informed about complex areas like healthcare quality and patient safety, it can feel like you're constantly trying to catch up.
It really can. There's just so much out there. How do you filter out what's actually vital?
Exactly.
Yeah.
And, well, that's precisely what we aim for here in the deep dive. We take the materials you share with us, dig into them, and pull out those key insights.
The essentials, basically, making sure you get that core understanding without getting buried in information.
So today, we're diving into something really fundamental for healthcare improvement, using the resources you sent over. Training and capacity building in hospitals.
That's right. And you've given us a great mix to work with.
Yeah, we've got website info from major players like Joint Commission International JCI and India's NABH, the National Accreditation Board for Hospitals and Healthcare Providers.
Plus, insights from Supremediq Consultancy, the global view from ISQA, the International Society for Quality in Healthcare.
And some really focused stuff, too. Excerpts discussing training methods, a transcript from the QI Playbook podcast, which looks useful, and promotional material from Supremediq again.
So our mission for this deep dive is pretty straightforward. Use all this information you've provided to figure out why training and capacity building are so critical for hospital quality and safety.
And what effective approaches actually look like on the ground, all based purely on these sources.
Okay, let's jump in. The why. Why is this area, training and capacity building, so absolutely crucial?
Well, the QI Playbook transcript had a point that really struck me. It said people resist change they don't understand or, feel unprepared for. That feels universally true, doesn't it?
It absolutely does. And that same transcript, the QI Playbook, it also spelled out some pretty serious consequences when that training isn't there.
Like what?
Well, think about teams just struggling with new ways of working, data being collected inconsistently so you can't even trust it.
Right. Undermining the whole effort.
Exactly. And then resistance builds up, improvement efforts just stall. It's like a chain reaction, all starting from people not feeling ready.
And that ties into this concept of capacity building. The QI Playbook defined it quite nicely, I thought. As developing the knowledge, the skills, the systems, even the leadership within teams.
So they can drive QI themselves independently.
Precisely. Over the long term. It's way more than just a quick training session. It's about building that internal engine for improvement.
That makes sense. And if you look at the missions of the big organizations you provided sources for, like JCI aiming for the highest standards of healthcare quality and patient safety for all.
And NABH working to establish and operate accreditation to set benchmarks for progress.
It's clear you can't hit those kinds of targets without people who are trained and capable. The workforce is fundamental.
Yeah, the standards are high, but someone has to actually do the work to meet them. It even comes through implicitly with Supremediq Consultancy.
How do you mean?
Well, their focus is on helping hospitals through that whole process, from planning right up to accreditation. You simply can't do that without staff who know what they're doing at every single step.
It's embedded in the whole journey. So, okay, if it's that important, what does effective training actually involve? What should be covered?
The sources give us a pretty detailed picture here. The QI Playbook lays out some core areas.
Like the basics of QI concept.
Exactly. PDSA cycles, root cause analysis, process mapping, using run charts, control charts, the foundational QI toolkit.
They're building blocks. Got it.
And then hugely important is data literacy.
Not just collecting data, but using it.
Right. Interpreting it properly, understanding the difference between, say, an outcome measure and the process measures that actually influence it. You need to understand the story the data tells.
Which flows naturally into problem solving, I suppose. The QI Playbook mentioned tools for that.
It did. Things like the 5 whys, fishbone diagrams, Pareto charts, structured ways to dig beneath the surface and find the real root causes.
Not just firefighting symptoms.
Okay. And then there's the people side. Teamwork, communication. Both the QI Playbook and the other texts really stress this.
Crucial in healthcare, where everything relies on collaboration, resolving conflict constructively, working across different roles.
Absolutely. And alongside that, change management comes up. Understanding how people adapt to change, strategies to overcome that inevitable resistance. Because QI often means changing habits.
Yeah, established ways of doing things. Makes sense.
The other text you provided broaden the scope a bit, too. They talk about improvement science as a discipline itself, understanding system complexity, how to measure within those complex systems, and the need for ongoing learning and reflection.
And that idea of sustainability keeps popping up. It's not just about a quick win.
No, it's about weaving QI into the hospital's DNA, making it sustainable.
And something else I noticed, drawing from both the podcast transcript and the general materials, the emphasis on involving patients.
Yes, that's such a critical point. Using their insights, their experiences, to make sure improvements actually matter to them.
It grounds the whole effort in the patient experience. Quality isn't just numbers on a dashboard.
Couldn't agree more. The general texts also really hammered home the need for continuous professional development, CPD, and regular in-service training.
Well, healthcare doesn't stand still, does it? Learning has to be ongoing.
And it's not just technical skills, right? The general texts talked about balancing those with
Interpersonal skills, patient-centered attitudes, professionalism, that holistic view.
right, and equipping people with practical tools, data analysis techniques, process mapping, lean management principles. I suppose Feed mentioned lean in healthcare too, I think.
So a really comprehensive view of what needs to be taught. Now, who needs all this training? Is it just for the designated quality managers?
Definitely not. The QI playbook was very explicit about that. QI is everyone's job.
So who is the target audience then, according to the sources?
It's broad.
Yeah.
Doctors, nurses, allied health professionals, obviously.
Yeah.
But also operations and admin staff.
Okay.
Support services, the pharmacy, housekeeping,
Yeah.
and critically, senior leadership needs to be involved and trained too.
Right. Leadership buy-in and understanding is key.
They used a brilliant example in the QI playbook, the billing clerk.
Ah, yes. How they can impact the patient experience.
Exactly. It perfectly illustrates that quality touches every single role, every interaction, not just the clinical ones.
And looking at the NHSRC materials, that's the National Health Systems Resource Center in India.
Right.
Their training initiatives specifically target a really wide range of professionals, too. Hospital superintendents, quality managers, nursing leaders, administrators, nodal officers, QA teams, assessors.
Wow, that's comprehensive.
It really shows that at a national level, there's recognition that this needs to reach across the board.
Okay, so we know what needs to be taught and who needs to learn it.
Right.
What about the how? What are the effective methods for delivering this training? The QI playbook had some ideas here.
Yes, they laid out a few useful formats, like traditional classroom sessions still have their place.
For foundational knowledge.
Yeah.
Induction, maybe.
Exactly. But then they highlighted things like on-the-job coaching, mentors, QI champions, working with teams on actual projects.
That sounds really practical. Learning by doing.
Very much so. And e-learning, of course. Flexible, scalable. You can use case studies, make it interactive.
Good point. And simulation or role-playing.
Yeah, for practicing those communication skills, maybe running through a root cause analysis in a safe space.
Makes sense. What else?
Short, frequent sessions. QI huddles, workshops, just regular check-ins to review progress, tackle problems, keeps the momentum going.
That reminds me, the guest interview on the QI Playbook podcast mentioned some specific tactics they found successful.
Oh yeah, like what?
The train-the-trainer model. Empowering internal people to train their own teams, using examples from their own hospital.
Makes it much more relevant. Localization.
Totally. And they had this thing called QI Thursdays. Short, maybe informal learning sessions. Sounds like a great way to make continuous learning feel less like a chore.
I like that. Bite-sized learning. And it fits with what the NHSRC does, too. They run various trainings, workshops, courses. It's clearly a multi-method approach that works.
So we train people effectively.
Yeah.
But how do we make sure it sticks?
Yeah.
That it leads to lasting change, real impact.
That sustainability piece again. The sources really emphasize that capacity building isn't about quick fixes. It's about creating a sustainable culture of quality.
Making it just how we do things around here.
Precisely. And the QI playbook offered some concrete actions for that.
Like making training continuous, not just a one-off event.
Yes. And localizing the content using your own hospital's case studies, your own data. That makes it hit home.
And measuring the impact, right?
Yeah.
Are projects actually improving things? Do staff feel more confident using QI tools?
Exactly. That feedback loop is vital to know if the training itself is working and how to adjust it.
And all this effort, ultimately, it circles back to those big goals we talked about earlier. JCI's vision of zero harm and highly reliable care.
And NABH pushing the benchmarks higher in India. Training and capacity building are the engine driving towards those goals.
We should also probably touch on the role of these external bodies themselves.
Good point. JCI, for instance, they're not just accreditors. They're a global leader offering Tons of resources.
Right.
Patient safety pathways, advisory services, publications, education programs, and they're everywhere, 70-plus countries, over 1,000 accredited programs. Huge reach.
And NABH plays that vital accreditation and standards role specifically within India as part of the Quality Council of India.
Then you have ISQA. They're more about connecting the global community, aren't they?
Yeah, a member-based organization focused on education, sharing knowledge, external evaluation. Their conferences sound like key events for learning and networking.
Right. And we already mentioned NHSRC developing and running training in India.
And even Supremediq, by helping hospitals with NABH accreditation, they're implicitly promoting the need for staff to understand and meet those quality standards, which requires training.
It all fits together.
So, wrapping this deep dive up, the message seems crystal clear from all these sources. Training in capacity building. They're not optional extras.
Not at all. They're foundational, absolutely core to achieving and sustaining quality improvement in hospitals.
And it needs a comprehensive, ongoing approach that involves everyone.
From top leadership to frontline staff, yeah. Equipping them with practical skills, data literacy, teamwork abilities.
But empowering them to actually lead and embrace change. It's a long-term investment in building that genuine culture of quality and safety.
So maybe the key question for you, the listener, to reflect on is this. Considering everything we've pulled from your sources today, the different training methods, the key topics, who needs to be involved?
Where, in your own specific context, your own hospital or healthcare setting, could one targeted training initiative make the biggest difference? The biggest ripple effect for quality and safety?
Maybe thinking back over the JCI standards, the NABH requirements, the ISQA principles, the practical tips from the QI playbook, perhaps that gives you a starting point.
We definitely encourage you to explore those resources further, JCI, NABH, ISQA, NHSRC, and think about how continuous learning and localized training could really take root in your environment.
Thanks for joining us for this deep dive.